My name is Torres, and I am presenting on trauma-sensitive yoga. The population for this research was individuals with post-traumatic stress disorder. The intervention that is proposed to integrate into practice is trauma-sensitive yoga as an adjunct to therapy. The comparison would be to therapy alone or medication alone. And the proposed outcome would be that patients would have decreased PTSD symptoms. PTSD is defined by the experience of a traumatic event that is followed by the development of 4 clusters of symptoms, including intrusive symptoms, avoidant symptoms, negative alterations in mood or cognitions, and increased arousal or reactivity. Chronic trauma exposure is associated with significant problems in affect and impulse regulation, and this is a significant issue for a large number of the patients that we see. So what is trauma-informed yoga? Trauma-informed yoga is adapted to the unique needs of each individual person who is working to overcome trauma. The idea is that it creates a safe space, and it's designed to help these patients learn how to respond rather than react to symptoms and circumstances. So there is considerable evidence that trauma-sensitive yoga is very effective. So we know that traditionally the treatments for PTSD has been medication and CBT, but we do have a growing body of research on the impact of mind-body interventions such as yoga. The evidence supports that it is effective, it is safe. There was one landmark study involving a large number of women with chronic treatment-resistant PTSD, and after only 10 sessions of yoga, the participants experienced significantly decreased PTSD symptoms compared to the control. In another study, there was a group that practiced yoga, and at the end of the study, the participants reported that they were better able to slow down, listen to their body and mind, be more aware of their thought patterns. They felt more regulation of their emotions, and overall it was effective for them. Studies have also demonstrated that a weekly yoga program compared with supportive therapy could significantly reduce PTSD symptoms in patients with chronic treatment-resistant PTSD. And in one particular study, it mentioned that the effect sizes were comparable to well-researched pharmacologic approaches. And so what are the recommendations for implementations into practice? So findings from most studies did advocate that the yoga instructors are specially educated in trauma-informed yoga specifically, just so that they are aware of the specific needs of this population. It's also been recommended that prior to initiating this, participants are educated on what to expect and to understand what the actual goals are of participating in this. so that they, know, so that they have reasonable expectations of themselves, and to hopefully reduce some of the barriers that might keep people from wanting to continue. Another recommendation is to keep classes small, to be mindful of touch and personal boundaries. And one other recommendation is to use invitational over command language to increase the participants feeling that they are, that they have a sense of choice and that they are safe. And so what are the implications for practice? So in a practice where, if it's a facility where they happen to have these types of classes available, such as, a VA hospital, it would be convenient, obviously, to incorporate this intervention into a patient's care plan. It might be a bit trickier if this is, an outpatient setting. And so a little bit more coordination would have to happen to locate the resource and, more or less connect the patient with this resource and encourage them to stick with it. Another implication is that if this were to, really pick up more steam and be more widely utilized, hopefully there would be more insurance companies that would actually cover this, because they would see it as an important component of treatment once they see that it actually is beneficial, it is decreasing the, the unwanted symptoms for patients. And then finally, if this was more widely utilized, then more providers would know that they can use this if, patients are not getting enough relief from medication or therapy alone.